Hi guys, only doing exposure today. My exposure is paratas, and so while we're doing that exposure, I'm also gonna turn the video on. The video that obviously shows my, I guess, because it's boring to kind of listen to me chew my food. So on a scale of 1 to 100, I feel choking to 0 again. To 0, getting exposure.
Psychomotor agitation, like pacing or wringing one's hands, or psychomotor impairment, like this overall slowing of thought and movements. Fatigue, feelings of worthlessness or guilt, lowered ability to think or concentrate, and finally recurrent thoughts of death or suicidality, including suicidal thoughts with or without a specific plan, as well as suicide attempts. And these symptoms must cause significant distress to the patient's daily life. Also, the depressive episode can't be due to a substance or other medical condition. The symptoms can't be better explained by another mental disorder like schizoaffective disorder. And finally, the patient can't have had a manic or hypomanic episode at any point. Additionally, sometimes major depressive disorder can be divided into subtypes or closely related conditions. Postpartum depression is a subtype that can happen following
just so you guys are aware, we're talking about depression, and then we're going to go into an anxiety video. So, I just want you guys to know, so my exposure here, I need to shut up, just listen.
childbirth. Although studies have shown that in many cases, onset of depression occurs prior to childbirth as well. So it's now diagnosed as depressive disorder with peripartum onset. In other words, the onset happens during pregnancy or 4 weeks following delivery. It's not quite understood why this happens, although hormonal changes likely play a role, especially estrogen and progesterone. Also, though, an abrupt change in lifestyle might be an important causal factor, especially because this can happen in men as well as women. Atypical depression is another important subtype that's characterized by an improved mood when exposed to pleasurable or positive events, called mood reactivity. And this is in contrast to other subtypes like melancholic depression, even during what used to be pleasurable events. Also, atypical depression often includes symptoms like weight gain or increased appetite, oversleeping, heavy feeling limbs, also known as leaden paralysis, and rejection sensitivity, essentially feeling anxiety at the slightest evidence of rejection. Finally, dysthymia, now known as persistent depressive disorder, is sometimes used to describe milder symptoms of depression that happen over longer periods of time. Specifically, 2 or more years with 2 or more of the following symptoms: a change in appetite, a change in sleep, fatigue or low energy, reduced self-esteem, decreased concentration or difficulty making decisions, and feelings of hopelessness or pessimism. Knowing that so many factors are probably involved in depression, it can be a challenge to treat. Although, with the right treatment, 70 to 80% of patients with clinical depression can significantly reduce their symptoms. Treatment can come in many forms and are most commonly grouped into one of 2 major categories. 1, non-pharmacologic approaches, in other words, things other than medications, and 2, pharmacologic approaches, either a single medication or combinations of medications. Starting with the non-medication approach, a number of studies have shown the benefits of physical activity in helping with depression. There are various reasons why it's thought to work, ranging from the release of neurotransmitters, endorphins, and endocannabinoids, to raising the body temperature and relaxing tense muscles. Regardless of the exact mechanisms, data suggest that exercising for 20 minutes, 3 times a week, can help alleviate depression symptoms. There's also a lot of research exploring the relationship between diet and depression. And although there are no silver bullet foods, many experts suggest healthy eating habits like more fruits and veggies. Beyond physical activity and healthy eating, which is more helpful for a number of reasons, another major non-pharmacologic approach is psychotherapy or talk therapy, which is definitely preferred for young patients and for those with milder symptoms. There are a few popular approaches, including cognitive behavior therapy and interpersonal therapy, and the most important thing here is that these approaches depend heavily on the relationship between the patient and the therapist, as well as the clinical skills of the therapist. If patients have more severe depression or mild depression for a longer period of time, then antidepressant medication might be prescribed along with the therapy. The most commonly prescribed medications are selective serotonin reuptake inhibitors, or SSRIs. In the synaptic cleft, after neurotransmitters get released, those neurotransmitters are normally reabsorbed. SSRIs block the reabsorption or inhibit the reuptake of serotonin, which means that there's going to be more serotonin in the synaptic cleft. Other classes of antidepressants that are less commonly prescribed are monoamine oxidase inhibitors, or MAOIs, and tricyclics. As a final last-line treatment for severe depression, ECT might be performed under written consent. ECT stands for electroconvulsive therapy, and is when a small and controlled amount of electric current is passed through the brain while patients are under general anesthesia, and this induces a brief seizure. Although ECT has been used for decades, and actually does seem to be effective for about 50% of patients, the reason why electrically induced seizures seem to improve symptoms is not well understood. Alright, clinical depression is tough, right? Both for those experiencing it and for those trying to help treat it. Unlike many other illnesses, depression carries with it a lot of social stigma and can lead to moral judgments that can make a person with depression feel even worse. Love and support from friends and family helps tremendously, and having a strong social support network has been proven to lead to better outcomes. Thanks for watching. You can help support us by donating on Patreon or subscribing to our channel or telling your friends about us on social media.
That's really interesting, guys. Let's learn about anxiety. That is the last one we're gonna get through. Here we go. Katie Morton has a really good thing on it. It's blah blah blah.
Hey everyone, this week's video topic comes to me from you and all of your requests. Anxiety disorder.
I apologize, guys. This is a generalized anxiety video. It's basically the same thing as social anxiety. As I said before, you have anxiety, you have depression, and you have psychosis. So let's focus on the anxiety part today. Let's continue the video, hopefully.
Say you've got a huge presentation in front of all your colleagues. You're nervous. You've got quite a bit of stress leading up to the presentation. That stress is completely normal, and really probably useful in certain situations since it can make you more alert and careful. After the presentation's over, you feel the stress start to fade away, right? Well, for 3% of the population, the stress doesn't go away, and maybe that stress isn't even brought on by a specific event, and it's always just sort of there. Either way, at this point, it's considered to be anxiety. That anxiety might get worse over time and cause things like chest pains or nightmares. Sometimes the anxiety is so severe that it causes someone to be anxious about leaving the house or doing everyday things, like going to work or school. This anxiety might be a sign of generalized anxiety disorder, sometimes shortened to GAD. GAD is characterized by excessive, persistent, and unreasonable anxiety about everyday things like money, family, work, and relationships. Even sometimes the thought of getting through the day causes anxiety. If the anxiety is persistent, then it doesn't seem to go away. If it's excessive, it's usually more than someone else might feel. And if it's unreasonable, they probably shouldn't have a reason to feel anxious about it. People who have GAD might even understand that their anxieties are excessive and unreasonable, but they feel it's out of their control and don't quite know how to stop it. People with severe GAD might be completely debilitated and have trouble with the simplest daily activities, or they might be only mildly affected and might be able to function socially and hold down a job. Sometimes the feelings might worsen or improve over time. In addition to having feelings of worries and anxiety, other symptoms include edginess and restlessness, difficulty concentrating or feeling like the mind just goes blank, and also irritability. And these psychological symptoms can also lead to physical manifestations of symptoms, like digestive problems from eating more or eating less. They might also have muscle aches and soreness from carrying tension in their muscles. Finally, difficulty sleeping is a really common symptom that can have a serious impact on physical well-being, since the body's not resting. And this can lead to issues of chronic fatigue. Although the decision that someone's worry is excessive and unreasonable has a subjective quality, diagnosing GAD is aided by the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. This manual gives a list of criteria to meet in order to be diagnosed with GAD. First, the excessive worry and anxiety has to have been present for more days than not over the course of 6 months. In other words, a person should have the symptoms of excess or unreasonable worry on 90 or more days out of 180 days. Generally, people can't quantify or track their feelings in that way. So again, this is meant to offer a general guideline, right? Okay, second, the person finds it hard to control their anxiety, meaning that they have a hard time calming themselves or self-soothing to help themselves regain control over their feelings. Third, an adult must have 3 or more of the symptoms listed previously. In children, though, typically defined as school age, so between 6 and about 18 years old, only 1 symptom is needed for the diagnosis of GAD. Another criteria is that the anxiety causes impairment in important daily activities like school or work. For example, they might miss deadlines or find it difficult